Hello everyone, it's Matthew McKenzie here. Back again doing another video. Um, and yeah, even though it's a lecture, it's basically you can see this one as more of a care awareness training video, but it's still a lecture. I usually do so many of them now. Anyway, as you probably already know, if you're not new to this channel, is I raise awareness of unpaid carers, specifically those caring for someone with mental ill health long term or caring for someone with cancer. And that's because of lived experience and the many groups that I do in order to engage and network with carers in a peer networking or engaging with services or professional bodies. And what you can see out of this video lecture is one of the organizations that I'm involved with, that being the Royal College of Nursing. And there's some really exciting things coming out of the Royal College of Nursing. But for now, I want to focus on how NHS staff, that being nurses, doctors, can show genuine compassion, respect, and understanding to unpaid carers. And apologies about my voice. I'm just still trying to recover from a bit of a cold. It's apparently gone, so I sound a bit funny. It's not just about staff or professionals, NHS professionals showing that compassion. Because in this video lecture, it's actually what I'm trying to mention to families and carers who visit their loved ones in those hospitals. And yeah, I do volunteer at quite a number of hospitals when I can, and I often see families and carers come up to the stall that I host and ask questions about, their role. And some of the things that I tell them, I felt I could point out in this video lecture so I can ask them to refer to that later because I'm not always in the hospitals. So this sort of lecture will take two forms. One will be obviously aimed at raising that care awareness to NHS professionals, but the other side of it will be aimed at families and carers on what things they should be looking out for when it comes to genuine compassion, respect, and understanding when it comes to families and carers. I mean unpaid carers, by the way, not care workers. Because obviously, when you're visiting a hospital, you're going to more likely be visiting a close relative or a friend, someone very close to you that you're more likely going to be caring for long term or will be discharged into your care. So let's continue. How can nurses or those who work in a hospital setting acknowledge and value the carer's role? Remember, this is focusing on carer awareness training, something I'm sure hospitals, and I do actually chair the London Hospital Discharge Toolkit, where we do get engagement from hospitals across London and sometimes further afield wanting to focus on the role of unpaid carers. So the first thing I would sort of mention really is that when engaging with those visiting loved ones in a hospital setting, and it doesn't have to be acute hospital, it can be mental health wards as well, is that I would expect um, nurses to listen to the carer's insight about the person they support. And it's not always the case, not 100%, but usually, majority of the time, the family or that close relative, the carer, would know what sort of works best. I'm not saying they're going to take over your role as the NHS professional. That's not their job. But when it comes to helping with diagnosis or family history, usually the carer knows best. The other thing, really, when it comes to acknowledging and valuing the carer's role is expressing appreciation to efforts like things you could say to the family or the main carer. And I'll just put an example here. You're doing an incredible job And we're here to support you in doing this. So the main reason, I suppose, also for this type of acknowledgement is there can be often, a clash when roles can collide. Um, and it usually can come down to, we know best attitude. And it shouldn't be about that. It should be in a form of a triangle, you know, keeping people involved at three ends of that triangle: patient, the professional, and the family or carer. So it's what people might say, what NHS staff might say to the carer when they're visiting a loved one or when they're expressing things that they're struggling with. What we don't want is professionals being dismissive and not valuing the carer's role. The last one, and this is with consent, of course, I've put that in there, is to include the conversations about care plans and discharge plans when it comes to acute settings or the mental health patient wards, inpatient wards. And I've tried to make it bold. I completely forgot, put asterisks there. But anyways, with the consent of the patient. And yes, it's sad to say this. There has been cases that I've known about where the consent was given and the conversation about the care plan was lacking. And rightly so. The carer or even the patient might complain about this. This is an ongoing thing, and this I mentioned is one of the reasons for this care awareness training or care lecture video. So we now looked at this from what I would expect from an NHS professional, but how can a carer know these things are taking place when it comes to acknowledgement and valuing the carer's role? So what should the family and carer look out for to confirm this is taking place? So carers will notice that their concerns are acknowledged, and then they'll sort of know when the professional being dismisses. There's things that they would say. Other things is when they actually are asked for input on the patient's care, and that's another sign that you should look out for if you are an unpaid carer or an informal carer. Lastly, on this one, they will feel heard rather than just being seen as an extra person in the room. And I've been on quite a few ward rounds due to lived experience and even supporting other carers, to be honest, as an advocate. And you can tell when the carer is just that extra person in the room because they wouldn't be asked any questions, they wouldn't be asked for their opinions, and they'd be sitting there silently, and that's not the sort of thing we want to see. So this is the first one out of some of the 7, I believe, we'll go through. Next bit is communicating openly and clearly with families and carers visiting loved ones in a hospital setting. So the biggest one, which is why I put this one first, is the NHS unfortunately is riddled with jargon and complex language. And, I can see the point of it because it can be shortcuts to explaining things. But it can also be a barrier that the public, the family, patient just don't understand what it means when it comes to treatment, medication, or prognosis. So it's an ongoing battle, this one. It's using that clear, jargon-free language when discussing those things. The next thing is ensure carers actually understand available support services and signpost them to relevant resources. And as mentioned, I chair the London Carers Hospital meeting, and there's quite a few times carer centres make a bit of noise saying, look, why are we not getting referrals from the hospitals regarding unpaid carers? And I know this because I'm in the hospitals running the carers stall. So it's so important when you identify unpaid carers or the main carer is to refer them and have, I'll give credit to one of the hospitals, St George's University Hospital, have carers hubs with leaflets and information just laying around for carers to see, even if staff is not always available to speak to them. The other one is, and this is a tricky one, transparency. A word that's floating around often around the NHS, and it can be a problem. But if you're an NHS professional, being transparent about what the NHS staff can or cannot do, and it can help to manage expectations. Now, I'm not saying all unpaid carers are angels and they make no mistakes. In fact, there can be situations where unreasonable demands are met. So it's important as a nurse or GP to know your role and explain to the care of family, what you can and can't do. This also means there are situations when professionals are not telling families what they should be doing, and that leaves families and carers guessing, and it could be led astray and not knowing what to do about their own role as a carer. So, okay, we've looked at again what I expect or what I'm sure what NHS professionals are trying to do in a hospital setting. How can a family carer notice these things are taking place? So, they will notice that NHS staff will take the time to explain things in a way they understand, and we're talking about the jargon. Carers, and again, this is signs to look out for, it's not just taking time to explain things, they will be given written or verbal information about support services. So there's that referral and what's available out there. Because when the patient is discharged to the family or carer, they do need that extra support out in the community. This is where the support services come in. And lastly, the family or unpaid care will feel comfortable asking questions without feeling rushed or dismissed. And this is again for ward rounds, I would think, or in a discussion about the patient situation. Now, I'm aware that NHS professionals and nurses are often under pressure. It's a high-pressured role, and there can be temptation to rush or dismiss the carer because resources are thin. But we've got to remember it's a false economy if the carer is not feeling confident in their role. And under the Care Act, 2014, carers can push back and say, no, I'm not accepting the discharge into my care. So it's important to take these things into account and engaging with families and carers about their role. So the next bit is the emotional support and empathy. I'm in two minds about empathy. I don't think being empathetic is something that can be easily taught. With a lot of work, I guess it can, to be honest. But there's situations I feel this person is very professional, but don't seem to show that empathy somehow. But let's look more into this. What am I expecting from NHS staff, nurses, and so on? It's acknowledging that caring for someone with a mental health condition is emotionally and can be physically demanding. So it's not basically what I mean by this is there will be 100% chance, 100% that a mental health carer will make mistakes. They'll have issues with the relationship they have with caring for someone with mental ill health. I'm just being realistic. There will be situations, if you care for someone bipolar, psychosis, self-harm, and major depression, there will be a strain in that relationship. So the idea really is when a carer does come running and they are looking for sympathy or an acknowledgement about the challenges they are having, this is when professionals can really take that to heart and say, listen, we understand. I'm not saying they've got a 100% way to fix that issue. We just are aware It is an emotionally and physically demanding role. The other one is offering, compassionate space. This must be really tough for you, but asking how is the family or carer coping, not assuming they're just there to pick things up and then be on their way. Obviously, there's more than one way of showing compassionate space, but this is just an example. And recognize and validate the carer's feeling that, it's okay to feel overwhelmed at times. And this, as I said, 100%, I haven't come across a mental health carer out there that has dealt with their role without any training, without any support. Um, it does depend upon the mental health condition, I do admit that. But for the ones that has chronic mental ill health, there will be situations where the carer or family will be overwhelmed. So, okay, we're going to look at this from the carer's side, the carer's perspective. How can they tell? What signs should they look out for to know this is happening? Well, they will observe that NHS staff will show warmth in their tone and body language. So it's not like their arms crossed or a stern voice or not looking at the carer. It's not that way. Carers should notice and they should look out for that to know this is actually happening. They are asked about their well-being, not just the patient. And look, I run many carer peer groups, and time and time again, when I ask how things are, the carer will launch into how the patient is doing. Nothing wrong in that fully, but it is a situation that I feel, and I always say this, and I'll stick with this, that carers, mental health carers as well, need to have time and space and be reminded and prompted to also look out for their own well-being. That's the point of these peer groups. But this can be done in a hospital setting as well. Not throwing everything you've got in order to provide that care and support. And I do admit resources are thin on the ground, and there might be situations you just have no choice. You're compelled to do it. But there should be a space to remind families and carers about their own well-being. Lastly, carers should notice that they don't feel like a burden when they're asking for help. And it's important also to remind families and carers, yes, you should ask for help. That is another lecture for another day, by the way, on what sort of things you should be asking for help for if things get out of control. So we've got probably about three more, really. This one is on respecting the carer's time and needs, and we'll look at this from what staff on mental health nurses or nurses. When I said I'm involved in the Royal College of Nursing, I'm involved on the mental health side of it. So avoid making carers repeat themselves again and again on unnecessary across different services. This one isn't 100%. There will be times when carers will have to. The risk is just too high in case things are not picked up properly, and that's a risk. But then the other side of the coin is carers will just get annoyed and fed up if they're having to keep repeat themselves regarding their situation. Flexible appointment times or phone check-ins when possible. I know it's not always possible, but that option should be there. And I've forgotten to put in online access as well. During the pandemic, a lot of services moved to online, and that does give even extra flexibility when it comes to checking in with carers. And I think that might be the way to go also in future. Um, Going back to that though, it's not the only way. It shouldn't be. There should be also um, situations where it's in person as well. So it shouldn't be the only option, but it is important to make use of technology. And also recognizing that carers, they have to work. That's why I put down the flexible appointment. I have to mention that there are working carers out there. In fact, there's a lot of changes in the law regarding the rights of working carers, hence those that have a job and need to hold on to that job the situation we don't want to find carers in is when they have to leave the job to care. So it's important to recognize carers may have work, family, or other commitments. So this is all about respecting the carer's time and needs. So how can families and carers know that this is taking place? Well, they can see that staff acknowledge the demands of caring and will try to attempt to show some flexibility. They'll also notice that they feel that their time is respected rather than being left waiting for long periods. A good example is being let in to see your loved one, whether it's on the mental health ward or an acute ward, or appointments when speaking to you about how you're coping. You're not left hanging. Lastly, they are given a point of contact for follow-ups instead of chasing for information. And it's not just follow-ups, it's just knowing who's in the team when it comes to supporting the person that you're caring for, rather than not knowing who to go to and why the unpaid carer needs to speak to them. That can be one of the biggest hurdles of being an unpaid carer, not really knowing who's in the team. So we're now looking at the care well-being and signposting to resources, what I've mentioned before regarding referrals, because carers are in some ways service users as well. Just because they might not be using the hospital bed, it doesn't mean that they are not using the service, and there are a lot of services out there. But how can, a mental health nurse or an NHS professional help guide that carer when it comes to acknowledging and valuing and being sympathetic? So it's informing carers about NHS care support services, respite care, or mental health support that is out there. And again, care centres are often going about these. They're absolutely valuable and important. Encourage carers to access forms of therapy, forms of peer support, carer peer support groups, and the care benefits, whether it's in-house services or without in the community. They are there, might be thin on the ground, refer them. If carers say that they're thin on the ground and they're audited, this brings the case to the integrated care system. They say that there is a need for funding such services, refer them, and remind carers that they don't have to do this all alone. One of the big issues with being an unpaid carer is that it can be an isolating experience. So I put the picture of a carer feeling isolated. 100%, that's usually the case, especially mental health carers. They're not trained in that role, so they are reliant on what's been told about their role, whether it's a peer support environment or coming from a mental health nurse or social worker. In fact, the other thing, I'll do a lecture regarding social workers. One thing with the Royal College of Nursing is there's a link between the British Association of Social Workers. So that's a future lecture coming in place. So, okay, how can carers know about what NHS professionals are doing when it comes to this sort of thing? What signs should they look out for? Well, they'll be given leaflets. You'll be handed leaflets about the services in the hospital, or the services that are outside. An example, like Carers Hub Lambeth services, Carers Merton. Well, it's actually now changed to Carers First, I believe. And Saturn Carers, the care centres, what's available from the local authority. Local authority may be doing the carers assessments. So links to specific care support services. You will also notice, if these things are taking place, that NHS staff will encourage you to take care of your own mental health. Remember, we can sometimes feel that because the carer is not using that hospital bed, that there's nothing they're having challenges with. This is not the case, and it's a worrying situation when it's the case of who's suffering the most. And yes, it's not a competition to who's suffering the most. What we're looking at is everyone getting their means of support. So it's important. It really is, because 100%, I still suffer from some form of trauma when, I've been caring for a while and still am in some sense. And what that shows is, did I get the chance for my mental well-being? So carers, unpaid carers out there, don't miss the opportunity to be encouraged to look after your mental health. It's not to say that you're weak or anything like that. It's nothing to do with that. It's just getting that support before it escalates to something you might find difficult to deal with. And also, something to look out for is that if the NHS professionals, those nurses, are being supported of your well-being, then you will feel supported, not left to figure things out. Very important. Remember, mental health carers, they're not trained for that role. Unpaid carers are not really trained in caring for dementia or cancer. It's something that happens, it might happen quickly. So we're depending on you, on the professionals. Last two, so involving carers in decision making, and I put them where appropriate. I am aware of confidentiality, especially for mental health carers, and it's so important that there's confidentiality for patients, so they have their right in privacy, and there's very good reasons for that. It's tricky, I do admit, sometimes it is a bit of a tug of war, but how can we know that NHS professionals are doing this? So first they should ask if they would like to be included in the care discussions with the patient's consent. And obviously the professionals will check with the patient, but they wouldn't just sort of not ask at all. That wouldn't be fair. And then leave the carer guessing, how, how involved they should be when it comes to involvement when caring for their loved ones, especially if the patient lives with the family and care. It would make it really difficult. It really would. And these are always ongoing discussions, not just the one type of thing. Relationships will change. There'll be a strain in that family dynamic regarding mental health, and sometimes even acute health as well. And keep them informed about change. In fact, I've gone a bit forward, but really keep them informed about changes in treatment of the care plans, and also respect the carer's expertise. If they're living with someone, if they've known them for all their lives, they will know them best. So it might make sense to ask them as well, what do you think might help? You live with them, you've known them for a while. Tricky, I admit it. You are, if any nurses are watching this video, you are the expert, you are the professional, but we can't dismiss the carer's knowledge as well. So how would carers notice this is actually happening? Well, first they're consulted before any major changes in care, especially when it comes to medication. The insights are valued rather than being dismissed. And they feel part of the team, part of that triangle of care rather than just an outsider. So the last one, really, what we're looking to see when it comes to care awareness is how can nurses be proactive in offering help and not just reacting to a crisis. So offer support before a situation reaches that crisis point. Provide early intervention strategies to reduce stress for both carers and their loved ones. And also ensure carers know where to turn for help before they reach that breaking point. I've got to admit, all these things I've mentioned are not easy. And number one reason is because it changes the staff, and you might not often see that family or the carer. But it helps to have something set aside, or even a template crisis or emergency plan provided to the family or carer. So how can families and carers know these things are happening? They will notice that NHS staff check in with them regularly, not just when things go wrong. They'll also receive guidance on preventing carer burnout. So I missed something there, carer burnout, and they will also feel supported, not just ignored until that crisis happens. So let's try and sum this all up. Basically, throughout this lecture's care awareness training, it helps to acknowledge and involve carers because you can recognize their role and expertise in patients' care. It'll help for professionals to actively listen to the carer's insights and include them in the care plan with, obviously, that consent of the patient. The other thing is communicate clearly and transparency. To sum that up, use simple jargon-free language when explaining treatment support services, but also provide written or verbal resources and ensure the carer can feel comfortable to ask questions. And the questions might be difficult, and it's okay to admit that you don't know and that you'll get back to them, or you can ask someone else. The other thing is respecting the carer's time and well-being. Avoid unnecessary repetition and offer flexible appointments or check-ins. Signpost care is available support services, including that respite and mental health support. And be proactive and not just reactive. Offer help before a crisis occurs, and also check in regularly and ensure carers feel valued, informed, and part of that team, part of that triangle, rather than just an afterthought. So as usual, I'm sorry that these lectures can be quite long. But if you felt it was useful, do give it a like and subscribe to the channel. I'll try and give more forms of online lectures when it comes to carers or mental health or awareness raising. Anyway, the last thing I want to mention is whether you're a professional or family care or even a patient, do look after yourself, and I'll see you next time. Thanks for watching.